We're looking at understanding diabetes today, specifically type 1 versus type 2. It's a condition that touches literally millions of lives, yet it still remains super misunderstood. People tend to throw both under this one massive umbrella term, but inside the human body, they operate in completely different ways. So we're going to break down these crucial mechanical differences, figure out why they actually matter, and see how getting this distinction right is just absolutely key to better health management.
First up, let's look at the scale of diabetes.
So at its very core, diabetes is defined as a chronic health condition characterized by sustained high blood sugar levels. And I want to emphasize that word, sustained. We aren't talking about a temporary sugar rush after eating a giant slice of cake. We're talking about a chronic, ongoing state where the body just cannot properly regulate the amount of glucose circulating in the blood. That foundational problem unites both types. But how the body actually gets into that state, well, that varies wildly. To put this into perspective, think about this number. A staggering 38 million adults in the United States are currently living with diabetes. 38 million. That is a massive portion of the population dealing with a chronic condition every single day. Honestly, it's highly likely that you or maybe someone close to you is part of that statistic. But here is what's truly mind-blowing and pretty concerning about that 38 million. 1 out of every 5 of those adults doesn't even know they have it. No clue at all. That leaves a huge segment of our population just walking around with sustained high blood sugar levels, completely unaware, and because of that, entirely unmanaged. This right here is exactly why bringing clarity to this topic is so incredibly important for all of us.
Let's move on to type 1, which is fundamentally an autoimmune attack. Right, so type 1 diabetes is strictly an autoimmune condition. What that means is the body's immune system, which, is supposed to be the good guy protecting you from outside threats, gets confused and mistakenly turns on itself. Specifically, it targets and destroys these things called beta cells located in the pancreas. If you picture the pancreas as the body's insulin factory, these beta cells are basically the essential workers on the assembly line. And because of this autoimmune attack, the pancreas is completely knocked offline. It can't produce insulin at all. Think of insulin like a key. It's the key that unlocks your body's cells so glucose can get inside and give you energy. Without that key, the glucose is quite literally locked out. It just builds up in the bloodstream, and boom, that's how you get those sustained high blood sugar levels we talked about. So, because the body simply isn't making its own insulin anymore, the treatment for type 1 strictly involves taking over that job manually. There's no way around it. It requires carefully monitoring blood sugar levels all day and administering insulin therapy to replace exactly what the pancreas can't make. It is a mandatory lifelong management strategy to replace a biological function that's just missing.
Okay, shifting gears now to type 2, insulin resistance. Now, this is a totally different situation. Unlike type 1, where the pancreas makes zero insulin, type 2 diabetes happens when the body develops what's called insulin resistance. The pancreas might actually still be churning out insulin, sometimes it's even working overtime to do it, but the body just can't use it efficiently anymore. Using our earlier metaphor, the keys are still there, but the locks on the cells have basically changed shape and become resistant to them.
And this breakdown, it doesn't just happen overnight. It's a progression. First, that insulin resistance starts to develop, which is often related to increased weight. Because the insulin isn't working right, blood glucose levels slowly start to rise. That triggers a high blood sugar state we call pre-diabetics. The sugar is elevated, sure, but it hasn't quite crossed the final threshold yet. But if it's left unchecked, that domino effect ultimately lands you at full type 2 diabetes. But here is where the story gets super hopeful, especially compared to type 1. Because type 2 is this progressive condition rooted in how the body uses insulin, it can actually sometimes be managed or even prevented entirely. If you catch it in that pre-diabetes phase, early lifestyle changes become a real game changer. We're talking deliberate adjustments to diet, getting regular exercise, avoiding smoking. Doing these things can literally change the trajectory of the condition and stop it right in its tracks.
Which brings us to our final section, management and empowerment. When you lay it all out side by side, it becomes incredibly clear why understanding this distinction is so vital. The causes and the treatments are fundamentally different. Type 1, autoimmune attack, requires strict insulin therapy. Type 2 stems from insulin resistance, which opens up the door for lifestyle changes, active management, and prevention. You absolutely cannot treat type 1 with just a good diet and a jog, and knowing that fact protects patients from some really dangerous misinformation out there. By grasping how each type starts and how it's treated, we're really encouraged to take true control over our health. When you know exactly what's happening under the hood, you can make informed decisions, you can set up preventative measures that actually make sense for your specific lifestyle, rather than just taking shots in the dark. This kind of knowledge, it literally translates into better health outcomes. But the impact goes way beyond just personal medical care. Spreading this awareness in our communities is such a powerful tool because it actively helps decrease the unfair social stigmas that diabetics face every day. So often, people make these sweeping negative assumptions about someone's diet or habits the second they hear the word diabetes. They don't realize a type 1 diabetic is battling an autoimmune condition that has absolutely nothing to do with their lifestyle choices. Basically, education breeds empathy. So as we wrap up, I want to leave you with this. Now that you clearly know the mechanical and medical differences, how are you going to use this new understanding of type 1 and type 2 diabetes? How will you use it to empower yourself and actually reduce the stigma in your own community? Think about how you can share this clarity with the people around you. Thanks for diving into this with me today, and as always, keep seeking to understand the why behind the facts.